I was involved in an accident, a head-on collision. The kid had hit me head-on that was on his phone. It was in September of 2018. I was taken to the emergency room from that accident, and I had a clear, completely snap, broken forearm. So initially, they treated me for the forearm break, and I noticed something was really wrong with my shoulder, and I was getting a lot of pain shooting down my upper back and through my arm. And so the orthopedic doctor scheduled me. They did some ultrasound in the office, and I definitely had some tendon issues in my shoulder, and sent me to MRI. So the broken bone led to getting the MRI, and they said, well, let's check, your neck and check your shoulder and all that area. So the MRI revealed that I had multiple complete tendon tears in my shoulder, and also revealed some neck herniations and from C4. They weren't really sure exactly where, but C4 and down. So after I got my shoulder tendons repaired, then my shoulder completely froze up and I couldn't even move it at all. It got stuck. I had to go back for a second surgery to break the frozen shoulder up. So the doctor that was up here was a great guy, but he wanted to do a fusion where there was metal outside my neck and really reduce the movement in my neck. And I was a little bit concerned with later on repercussions. So I started really researching, and that's what led me to find Dr. T. So this was during the pandemic, of course it's still going on, but they took time to meet me on the first available Saturday and met me and my wife in their office. They had me get the imaging that I had already gotten done, and I got that imaging. They met me on a Saturday morning, opened up their office for us, and Dr. T right away, he put the CD in his computer program and started reviewing, my imaging, and just did such a thorough explanation. I'd been through a year and a half of doctors and procedures, and no one ever took the time like Dr. T did to explain to me exactly what was going on in my body. He took the time to just really, really in depth just describe to exactly what I was facing, how he would how his procedure would go ahead and fix me to the best that he could. So upon that follow-up, when we had the second, he was concerned about my shoulder, which that imaging showed up on my MRI, and I was having a lot of problems and frustration with my shoulder. So he pinpointed the problems in a year and a half of PT, 2 surgeries, kind of figured out exactly what was going on with my shoulder. But then leading into the neck, he took his imaging, showed me his computer in a 3D style computer. Going down my spine, showed how a normal vertebrae should look with the open gaps, and found stenosis and also the torn herniated discs, and how it was compressing my nerves and the problems that it was giving me, and that was exactly what I was experiencing. So at least it gave me relieved a lot of my anxiety of knowing exactly what was going on, and then how his procedures and how he goes in with way less innovative style. So I was so excited once he really took the time to explain to me exactly what was going on and his style of surgery. This is during, the COVID-19 going on. They actually had found a orthopedics or a surgery center that they could do it during this time. So we had to go through all kinds of independent doctors. I needed blood tests, I needed EKGs, I needed urinalysis, just a bunch of tests. So Kate, I said, well, how am I going to get all this done? Well, she scheduled all that for me. And in a matter of, within a week, I had all those tests done with the help of Dr. T and Kate at Microspine. Just phenomenal how fast that happened. And once I had that done, the week later, they had me scheduled to go into surgery. So the day of the surgery, they made me comfortable at first. Once I got there, I was the only patient at the time, and they had a full staff there. Explained to me exactly what was going to go on. Once I awoke in the recovery center, they had a great staff there, helped me, relieve that first initial kind of ill feeling of the anesthesia. And Dr. T and Kate were doing another procedure. Well, the minute they got out of that procedure, they checked on me at least 2 or 3 times while I was recovering in there. Just made me feel really comfortable. That evening going home, they personally called me and texted me to check on, how I was doing. And just, it was just fantastic I thought this kind of level of cut or, patient doctor interaction is actually was a long lost art, but finding them, I was just so impressed with, how personal and treating you like family. It was just amazing. I had a follow up post 2 weeks after surgery. The first 2 weeks, I was any questions I had. I don't care what time I text them, they got back to me right away. I was experiencing this kind of pain or that kind of pain, and they relieved my anxiety. Say, hey Frank, that's normal, or help. They adjusted some of my medications to make me more comfortable, and I mean, I can't express how fast they got back to me. Like on a personal text, no red tape, no nothing, just boom. I mean, they treated me like family. In my recovery right now, I've been comfortable. Of course, I'm feeling the normal post-surgical pain, but right away I noticed my vision was clear, no kidding, and I could hear better. This guy has so many compressed nerves, and the pain that I was experiencing, the nerve pain from what was pinched, I mean, I felt that relief from that in a matter of the first 2 or 3 days. And even today, right now, my range of motion is already better. Here I am, only 4 weeks out, driving myself to the PT place, and going to have my first evaluation with my PT doctor right now. I'm just the 4 week out mark. We couldn't do anything actually actively. Dr. T is sending me videos, personal videos on the phone, like what kind of stretches to do at home and stuff that I could do myself to help speed up my recovery. And just checked up with me, so frequently to make sure I'm doing okay. We had the first follow-up 2 weeks after. They ordered new imaging, and just so, what's the right word I'm looking for? Just detailed to make sure everything is correct. So I went and they ordered a second set of imaging for me. That was approved. That way we make sure everything's going okay. And I'm meeting them again in about a week after I go through some of the physical therapy. And then again, they ordered and getting me another set of imaging done to make sure everything is fine. And that's something that I haven't experienced with any other doctors that I've been through. And I've been through quite a lot prior to meeting Dr. T and Kate.